What are some common allergies that can trigger wheezing?
You know, patients are pretty good at guessing, all right? Spring and fall, they do a good job. Cats, they're always right. I'm not even sure why we test them to cat. They've never wrong. Every patient I've ever had, if I'm allergic to cat, is allergic to cat. But there's other things they don't know they're allergic to. Dust mites, mold, cockroach. We need to know. These are common. They're more important in certain populations, maybe in inner city or children, but dust mites for all of us are bad for asthma.
So when you identify that, how do you identify whether they're allergic? With skin testing?
A skin test, and that's a simple test with a plastic device, takes 20 to 30 minutes to do, and the vast majority of patients, wow, that was simple. I should have done this years ago.
Do people's nose allergies bother their lung allergies?
Absolutely. I tell patients every day, multiple times a day, if this isn't happy, this isn't happy.
So how do you get this happy?
You have to know what's going on in there. Is it allergies? We do the allergy test. Is it sinus disease? Is it nasal polyps? Is it aspirin allergy? There's a lot of things that contribute to that. But we've got to do everything we can. It's just as important to get this healthy as it is this in an asthmatic.
So the things that can cause the nose to be causing trouble would be allergy, or you said polyps,
yes,
or you said sinus infection. So how do you find out if they've got those things?
Yes, well, allergies, we've talked about the allergy
Skin
test
testing.
a time or two. Easy, that gives us a quick answer to that. Sinus, nasal polyps, you can often see just with looking in the nose. Sometimes we do rhinolaryngoscopy, a camera where we look through the nose and down to the voice box to see if you see polyps. The sinuses, sometimes you can see with a scope, but sometimes you have to do an x-ray, a CAT scan of the sinuses. It lets us know what's going on in there. And it's not always infection. Sometimes it's chronic inflammatory sinusitis.